Hey everybody, how are you? We are going to move on to the second part of our medical coding series here. We're going to talk about ICD-10 coding. If you just wrapped up the CPT video, great. If you didn't, check that out. It goes hand in hand with this one. So let's go ahead and just get into this. This is the second video too in what's going to be an administrative series. So I'll have that in a playlist for you so you can keep everything kind of organized. Okay, so let's talk about ICD-10 coding. ICD-10 coding is diagnostic coding. In the other video, and again, if you haven't watched it already, I would really recommend you do. But in the other video, we talked about procedural coding, basically the what, okay? I always describe it as the what and the why. Okay, so procedural coding is the what. What did we do with the patient? And then ICD coding or diagnostic coding is the why did we do it? And the reason this is so important is because when our billers and our coders send out or submit claims for reimbursement on all of these wonderful things that we do to help people to the insurance companies. The insurance company wants to know what they're paying for and why they're paying for it. Okay. It's just like I always use the analogy that if I came to you and asked you to borrow $5, more than likely your first question would be, well, what do you need it for? Okay. That's kind of how it works with the insurance companies. We're asking them to pay us for services that we have rendered. Um, and they want to know why. Why did we do that? Okay. So that's where diagnostic coding comes in. And the abbreviation ICD stands for International Classification of Diseases. The first edition of this group of codes was out really in 1948, so quite a long time ago, and has always been managed by the World Health Organization, or WHO. So this is an international effort, whereas CPT coding is current procedural terminology that is overseen by the American Medical Association, so just local to the US. ICD coding is actually managed by the World Health Organization and is an international effort. The uses for ICD coding is above and beyond the billing aspect of it is to track disease, classify the cause of disease, and for data collection for research. It's very helpful for that as well. All right, so there is a difference between ICD-10 CM and ICD-10 PCS. As a medical assistant, we really deal primarily with the ICD-CM or ICD-10 CM in this case. The CM stands for clinical modification. These are codes that are used primarily in clinical settings, also in hospital settings, but they are in clinical and hospital settings for use. ICD-10 PCS, Procedure Coding System, is what PCS stands for, is used only in a hospital setting. So given that medical assistants work primarily in clinical settings, ambulatory care, doctor's offices, private practices, things like that, urgent care, we are going to see the ICD-10 CM version more often than not. And that's not to say that some MAs don't work in hospitals. They do, just not as commonly because MAs tend to only work in hospitals that are in like rural areas, smaller hospitals. Um, if you're an MA working in a hospital setting, let me know in the comments because I'm always very curious about that. I know in my area and the areas in which I've worked in, that's not as common, but I have seen it, like I said, in the rural areas with the smaller hospitals. All right, so here is your ICD-10 manual. This is the ICD-10 CM 2025 manual. You'll notice it does say AMA on there, primarily because that's just there. It's published by AMA, but it is still managed by WHO. And this manual, very, very similar to the CPT manual, contains an index, an alphabetic index, and a tabular list. The tabular list in the ICD-10 manual is broken up into 21 chapters versus the CPT manual where it was more in sections. Okay. So the format of an ICD-10 code is specific. So we talked about CPT codes being 5 digits. ICD-10 codes can vary in their size, but have certain things that are consistent. So it always begins with 3 characters followed by a decimal. The first character is always a letter in ICD-10. It has not always been that way. So for some of you who've been around for a while, let's see, ICD-10, I feel like, and I may be misspeaking, I feel like ICD-10 was first implemented in 2015. I know it was October. I want to say it's 2015. Prior to that, we had ICD-9, because that's what the 10 is. It's the 10th version or the 10th revision. Um, I dealt with ICD-9 my entire career in field, and those did not have letters in them. So, except for very few. So it's a little different. We went from having roughly 14,000 codes in ICD-9 to 70, yes, that's 70,000 codes in ICD-10. Reason for it is they were just looking to be more specific with the coding. So first letter is always, or first character, I'm sorry, is always a letter. The next 2 characters are usually numbers. The first 3 characters and the reason they are set that way basically shows where the code is in the tabular list, and it stands for the basic condition. So the first 3 letters of, say, hypertension are always going to be the same because that's the basic condition. And then there are various, variations on hypertension. Then the 1 to 4 characters that follow the decimal point, because an ICD-10 code can have up to a total of 7 characters, um, makes the diagnosis a little more specific. There can be a lowercase x used as like a placeholder, especially if there hasn't been like a full diagnosis yet. And then if the 7th letter or 7th character is a letter A, that refers to the point or to the fact that it is the initial visit. It's the first time the patient's being seen for that particular complaint or whatever. Do also understand too that oftentimes diagnostic coding is not necessarily showing an exact diagnosis. A lot of times the ICD-10 code is actually reflecting a symptom. And let me give you an example. Say that you were, I don't know, oh, got sirens going by my house, sorry. Say that you were taking a throat a specimen from a throat, via swab, to send to the lab because the providers ordered a culture for it. Okay. You have to have the ICD-10 code along with the procedure code to explain why that's been ordered, right? Well, if we're looking to get a diagnosis based off of the testing, then there's no real diagnosis yet. You can't say that it's strep throat when you're having it tested for strep, if that makes sense. But you still have to have that why as to why you're sending that out and why the lab is going to process that. So in that case, you would really use more of a symptom like throat pain, or even it's kind of a stretch, but maybe pharyngitis, right? So that's more of a symptom that you're using while you're waiting on a definitive diagnosis. I hope that makes sense. And you can play that back if it doesn't. But so yeah, oftentimes the diagnostic code is really just a symptom, not an actual diagnosis yet. Okay, when we're using ICD-10 codes, we want to make sure that the code that we find matches the diagnosis or the symptom that's documented by the provider. We can't just willy-nilly make these things up, okay? It has to be something that the provider actually documented, okay? And yes, sometimes that takes a little bit of going through their progress notes to find it if they weren't real clear about it. But it has to be something that was documented by the provider. We can't diagnose. And I'm sure I've said it before, and I will continue to say this. Big no-no that MAs diagnose. Okay, so don't do it. Don't even say that sounds like. Okay, don't even do that. Um, we use ICD-10 codes also um, to differentiate between like primary and secondary reasons for visits. So the primary reason for the visit is always going to be the first ICD-10 code that's listed. You can have multiple numbers of ICD-10 codes listed out as diagnosis codes. But the very first one is always going to be related to the primary reason why the patient was seen in the first place. The way to do this is to locate the code in the alphabetic index and then go to the tabular list where the index tells you to go to increase the specificity of that, to look for the additional characters. Very similar to CPT. You find it in the index, go to the tabular, and then make sure you have the exact or best code that will be used. If you haven't already, please, if I could ask you, and if you're enjoying these videos, click the like and subscribe and even the alert bell, because then every time I come out with a new video, it will alert you to its presence. But if you haven't done that already, I'd really appreciate it. It means a lot to me, and it really helps me to continue to do this work for you. All right, special codes for patients without disease or injury. So think about that for a minute, right? You'll have patients that come in that aren't necessarily sick. They're coming in for a checkup or their yearly well visit or something like that. We still have to have a diagnosis code. And if there's nothing, quote unquote, wrong with them, um, there's really nothing to find, right? So there are special codes for this, and they are called Z codes, okay? Z01 through Z99 are the beginning of the codes. These can be used as primary codes for like routine exams or if patients coming in for immunizations, especially with children. Um, and a good example would be Z00.129. That is the code for a routine child health exam without abnormal findings. Okay, so patients just coming in for their, depending on their age, monthly, yearly, whatever exam, well child exam, as they always call them. And there's nothing else wrong with them. They haven't found anything wrong with them. You would use the Z00.129 along with the CPT code to explain why the patient was being seen. There are also special codes called external cause codes, which help to make it a little more specific about what caused the injury or illness. These are V codes, and these are V01 through V99. External cause of injury codes We only use these in combination with other codes just to give more information about the cause of the issue, the disease, the injury, what have you. An example of that would be V03.00XA, which would be used for a pedestrian on foot injured in a collision with a vehicle initial encounter, meaning this is the first time they're seen for it. So if someone got hit by a car. Um, we see that a lot, initial encounter, subsequent encounter, things like that, especially in injuries, because it's not like they're going to be seen necessarily just once and then that's it. So we have to use the subsequent, or what they call sequela visits, codes for the visits after that first one. All righty. There is also the matter of making sure that you are using the correct level of coding. There's a couple terms that you want to be familiar with here. One is called upcoding, one is called downcoding. Makes sense. Upcoding's when medical codes are used to get or obtain a higher level of reimbursement than what's actually due. So it's basically you're using codes that are going to yield higher pay than the amount of work your office actually did. Okay. Um, say you saw a very kind of low level, just patient came in, quick little once over and they're gone, and you're charging for, as we talked about in CPT coding, an expanded, comprehensive, visit, that would be upcoding. And if your billers, coders, your practice, or whoever's representing your practice in that manner is found to be doing that and a pattern starts to emerge, it's one thing like if they went, oops, and although ignorance is not a defense in this, but usually if it happens like once or twice, it's not going to be as big of a deal. It's not going to shoot up red flags because those could be, honest mistakes. But if someone sees especially if a insurance company starts to see a pattern of this happening, this can result in fines. It can result in investigation. It can result in the coders losing their job. Big no-no, big no-no. And if you're doing this with Medicare or Medicaid, really, really big no-no. Downcoding is when the medical code is not at a high enough level for the service. This can also trigger an audit. People say, well, but they're not charging enough. That shouldn't be a big deal. You're not trying to, scam people. Yes, but if you have someone who is either purposefully or by accident continuously downcoding, something's not right. And that can actually trigger an audit of all of the records. So you really want to be careful with that. It's not worth it. It's just not worth it. All righty. So I want to thank you guys for watching. We will see you next time for sure. And I'm just going to kind of continue on this administrative kick, I think. Again, it's one of those things that students and MAs alike are not always super jazzed to learn about, but it is really, really essential to what we do. And you really will be glad that you've learned it. So until I see you again, take care. And as always, if there's something specific that you want to see me go over, explain, even if you have questions, please just drop it in the comments and I will definitely get to that. So until next time, take care.